Picture this. You're sitting in your doctor's office and they mention something about sugar sticking to your proteins. You may nod politely, but inside you're thinking, wait, what does that actually mean? And more importantly, why should I care? Welcome, everyone, to this episode of the College of Glycation. I'm Paul Reynolds, a biomedical scientist and professor of cell biology and physiology. And here's why you should care. This process is called glycation, and it's happening in your body right now. And if you have diabetes, or even if your blood sugar runs a bit high sometimes, glycation could be quietly setting the stage for serious problems. And our focus today is on the role, therefore, of glycation in kidney damage. We're talking about the cascade of events that can lead to diabetic kidney disease, chronic kidney disease, and yes, even an increased risk of death. Today we're discussing the world of glycation renal complications. We'll explore what glycation actually is, why it matters so much for your kidneys, and more importantly, what cutting-edge science tells us about preventing this silent threat. By the end of this episode, you'll understand why researchers are racing to develop new therapies targeting this process, and what you can do right now to protect your kidney health. Glycation is essentially the unwanted marriage between sugar molecules and proteins or fats in your body. Unlike carefully controlled processes your body uses to break down food and create energy, glycation happens spontaneously, without any enzyme directing the traffic. It's a chemical reaction that occurs when excess glucose in your bloodstream bumps into and attaches to proteins or lipids throughout the body. Think of it like rust forming on metal. I've mentioned this before. Just as oxygen gradually corrodes iron when exposed to moisture, glucose gradually modifies proteins when there's too much of it floating around in your blood. And just like rust weakens metal, these modified proteins called advanced glycation end products or AGEs compromise the normal function of your tissues. When your blood sugar is elevated, whether from insulin resistance, insufficient insulin production, or poor blood sugar control, you're creating a perfect storm for glycation to thrive. Studies have shown that even modest elevations in blood glucose can significantly accelerate age formation. Recent research by Vascular and colleagues demonstrated that circulating age levels are dramatically elevated in patients with diabetes, and these levels correlate directly with the severity of their complications. But glycation doesn't just affect one type of protein, and this is important. It is an indiscriminate process. It can modify hemoglobin in your red blood cells, which is actually how your doctor measures your average blood sugar with the HbA1c test. And crucially for our discussion today, it can modify the structural proteins in your kidneys, the proteins that actually filter your blood and the proteins that line your blood vessels. The kidneys are particularly vulnerable because they're constantly exposed to high concentrations of glucose during the process of blood filtration. Your kidneys produce about 180 liters of blood, or rather process 180 liters of blood every single day, and with each pass, glucose has another opportunity to bind kidney proteins. Over months and years, this leads to an accumulation of AGEs in the delicate filtering structures of the kidney. So what makes AGEs especially dangerous is that they are remarkably stable. Once they form, they don't easily go away. They accumulate over time, gradually transforming the very architecture in your tissues. The link between glycation and kidney disease isn't theoretical. It is, in fact, backed by decades of clinical observation and rigorous scientific research. When AGEs accumulate in renal tissues, they don't just sit there passively. They actively participate in causing damage through multiple mechanisms. First, consider the structural consequences. The glomeruli, those are the tiny filtering units in your kidneys, are essentially sophisticated sieves made of specialized cells and a basement membrane. When AGEs accumulate in this basement membrane, they cause it to thicken and become less flexible. Recent studies by Brownlee and colleagues have shown that this thickening is one of the earliest detectable changes in diabetic nephropathy. But the damage extends beyond just structural changes. AGEs, mechanistically, also accumulate in the mesangium, that is the supportive tissue between the capillary loops in your glomeruli and neighboring tissues. This triggers cells to produce excess extracellular matrix, essentially laying down scar tissue where there should be functional filtering apparatus. Over time, this process is called glomerulosclerosis, which is the reduction of the kidney's ability to filter waste in your blood due to the buildup of this tissue. The numbers tell a sobering story. Research published in Diabetes Care by Nin and colleagues found that patients with high levels of circulating AGEs had a significantly increased risk of developing end-stage renal disease. Specifically, they showed that for every standard deviation increase in plasma AGE levels, there was approximately a 50% increase in the risk of kidney function decline over a 10-year period. That is very sobering. Now, the vascular damage caused by AGEs is equally concerning. Your kidneys rely on an intricate network of blood vessels to deliver oxygen and nutrients. AGEs, however, damage these vessels through several mechanisms. First, they promote endothelial cell dysfunction, meaning the cells that line your blood vessels cannot properly regulate blood flow. They increase vascular permeability, allowing proteins that should stay in the bloodstream to leak across this barrier into tissues. AGEs also accelerate atherosclerosis, which is the hardening and narrowing of arteries. Again, it's non-discriminate, so these arteries in the kidney apparatus are also susceptible. Perhaps most alarmingly, this isn't just about kidney function and isolation. Research by Miata and colleagues demonstrated that age accumulation in the kidneys correlates with overall mortality in diabetic patients. They found that higher kidney age levels were associated with a 2 to 3-fold increase in mortality risk over 5 years, independent of any other risk factors. So the spectrum of damage begins early, often before symptoms appear. Microalbuminuria is the presence of small amounts of the albumin protein in urine, and that is one of the first detectable signs that glycation is damaging the kidney's filtering barriers. If left unchecked, this progresses to overt proteinuria. That's excessive protein in your urine. And of course, related to that would be declining kidney function and ultimately chronic kidney disease requiring dialysis or transplantation. Now let's examine exactly how AGEs wreak havoc at the cellular and molecular level. Understanding these mechanisms on the surface would reveal potential therapeutic targets that researchers are actively pursuing today. The story begins with the age-RAGE signaling pathway. RAGE stands for the receptor for AGEs, or advanced glycation end products. It is a protein receptor found on the surface of many cell types throughout the body, including kidney cells. When AGEs bind to RAGE, their receptor, they trigger a cascade of cellular responses that are largely inflammatory in nature and damaging. Researchers, including Yamamoto and others, demonstrated that the age-RAGE interaction activates the nuclear factor kappa B, or NF kappa B, which is a master regulator of inflammation. Once activated, NF kappa B travels to the cell nucleus and turns on genes that produce inflammatory molecules like cytokines, such as tumor necrosis factor A, or TNF alpha, interleukin 6, and interleukin 1 beta. These molecules, or cytokines, create a state of chronic low-grade inflammation in kidney tissues, gradually eroding their function. But keep in mind, this inflammation process is just one piece of the puzzle. Age-RAGE signaling also triggers increased oxidative stress. Imagine oxidative stress as cellular rusting, like the rust we talked about earlier in the episode. This occurs when reactive oxygen species overwhelm the cell's normal antioxidant defenses. Many studies, such as one conducted by Forbes and colleagues, showed that age exposure dramatically increases superoxide production in kidney cells. That is a form of deleterious oxidative stress. This oxidative stress damages DNA, damages proteins, and compromises cellular membranes. So the endothelial cells that line your blood vessels are one of the cell types that are particularly sensitive to this oxidative assault. Research has already demonstrated that age-induced oxidative stress impairs nitric oxide production. That's a critical molecule, nitric oxide, that helps your blood vessels relax and maintain proper blood flow. Without adequate nitric oxide, blood vessels become constricted, stiff, and dysfunctional, contributing to hypertension and reduced kidney blood flow. Another critical mechanism involves protein cross-linking. AGEs don't just modify individual proteins, they can in fact form bridges between proteins that should not be connected. In the kidney's basement membrane, for instance, this cross-linking transforms a normal flexible basement membrane structure into something that is more rigid and highly dysfunctional. Think of it like turning a stretchy rubber band into a brittle piece of plastic. This brings us to a notable cell type in the kidney known as the podocyte, arguably the most important cell in the kidney's filtering apparatus. Podocytes are specialized cells with foot-like projections, thus the prefix podo, or foot. These foot-like projections wrap around capillaries in the glomerulus. Research by Tanji and colleagues revealed that AGEs cause these podocytes to retract their foot processes, a change that leads to proteinuria because the filtering slits between the feet are expanded. Moreover, AGEs can trigger podocyte cell death. Since podocytes have limited ability to regenerate, their loss is essentially permanent, leading to kidney damage and disease. The interplay with diabetes specifically amplifies everything that we've talked about. Hyperglycemia doesn't just increase age formation, it also is considered to amplify it exponentially. Studies have shown that each 1% increase in your HbA1c correlates with approximately a 40% increase in circulating age levels. Furthermore, high glucose environments enhance RAGE expression, meaning cells become more sensitive to whatever AGEs are present at the time. So this, you can see, creates a vicious cycle where poor blood sugar control accelerates age damage, which worsens kidney function, that therefore further impairs blood sugar control. That loop is a problem. The scientific community has made remarkable progress in understanding how ages contribute to kidney disease. So let's explore some of the most compelling findings to date. One landmark study from Miyata and colleagues tracked circulating age levels in diabetic patients over several years. This publication and all others referenced in this episode are shown in the show notes below. Those researchers, Miyata and colleagues, measured specific ages like pentosodine and carboxymethyl and found that elevated levels at baseline predicted both the rate of kidney function decline and patient mortality or death. Patients in the highest quartile of age levels had approximately 3 times the risk of progressing to end-stage renal disease compared to those in the lowest quartile. Meta-analyses have further strengthened this connection. One such comprehensive systematic review by Hansen and colleagues examined data from multiple cohorts totaling over 5,000 patients with diabetes. Across multiple studies, they found consistent associations between various age markers and microvascular complications, including nephropathy, or disease of the kidney. The pooled analysis showed that for every standard deviation increase in skin autofluorescence, that's a non-invasive measure of age accumulation, there was a hazard ratio of 2.2 for developing or progressing chronic kidney disease. Animal models have also been crucial in establishing causation rather than just correlation. Studies, for instance, that use diabetic rodent models have shown that interventions specifically targeting age accrual can prevent kidney disease. For example, research by Forbes and colleagues demonstrated that treating diabetic mice with compounds that break age crosslinks resulted in reduced glomerulosclerosis, less proteinuria, and better preservation of kidney function compared to untreated diabetic mice. That was a hallmark study. Human studies have also examined the impact of diet on age exposure. Urabari and colleagues conducted research showing that Western diets high in processed foods, overly or excess grilled meats, and foods cooked at high dry temperatures significantly increase circulating age levels. In their intervention study, participants who switched to a diet lower in ages showed measurable reductions in inflammatory markers and improvements in insulin sensitivity over just 4 weeks. Research has also examined age accumulation in kidney tissue itself. Studies using kidney biopsies from patients with varying stages of diabetic nephropathy found that age accumulation correlated strongly with the degree of structural damage and with clinical markers of kidney disease like serum creatinine and proteinuria. Given everything we now know about the ages and ages that damage kidneys, what can actually be done about it? Some of you may be wondering. The good news is that we have several evidence-based strategies ranging from basic lifestyle modifications to emerging pharmaceutical interventions. Let's start with blood sugar control. The foundation of any strategy to reduce glycation is controlling blood sugar. The relationship between glucose levels and age formation is direct and dose dependent. The Diabetes Control and Complications trial showed that maintaining HbA1c levels below 7% reduced the risk of microalbuminuria by 39% and clinical nephropathy by 54% over time. Again, that's keeping your A1C levels below 7% consistently. For practical purposes, achieving an HbA1c level between 6.5% and 7% appears to be a good spot for most people with diagnosed diabetes, balancing benefits against the risk of hypoglycemia. Now let's talk about your diet, because what you eat directly influences your age exposure. Research distinguishes between endogenously formed AGEs, those that your body makes from high blood sugar, and exogenous AGEs, which you consume in food. Studies show that typical Western diets can contain 15,000 to 25,000 kilounits of AGEs per day, with significant absorption into the bloodstream. So high heat, drier cooking methods like over-grilling, that's the charring and frying of meat, will increase age content in foods. A grilled chicken breast contains roughly 4 times the ages of the same chicken breast that's poached or steamed. Note, once again, the ages really cross this excessive threshold when the meat is over-grilled, charred, and cooked significantly. Research demonstrated that reducing dietary age intake by 50% through modified cooking strategies resulted in a 30% reduction in circulating age levels within a period of about 4 weeks. So practical strategies could include periodic steaming and boiling and those types of things, which will inhibit or slow down age formation during the cooking process. Exercise also deserves special attention. Beyond its well-known benefits for blood sugar control, physical activity appears to have direct anti-age effects. Studies found that regular aerobic exercise reduced circulating age levels independent of changes in body weight or glucose control. In fact, clinical guidelines suggest at least 150 minutes of moderate intensity aerobic activity per week, if possible, along with resistance training twice weekly if available. Lifestyle factors beyond diet and exercise also matter. Smoking dramatically increases age formation and should be completely avoided if possible. Research shows, in fact, that smokers have age levels that are 25 to 40% higher than non-smokers. Adequate hydration supports kidney function and may also enhance age clearance. So where does all this leave us? Well, glycation is not some obscure biochemical curiosity. It is, in fact, a fundamental mechanism of kidney damage in diabetes and other metabolic conditions. The non-enzymatic binding of sugars to proteins creates AGEs that accumulate in kidney tissues, trigger inflammation and oxidative stress, and structurally damage various proteins that lead to problems in filtration. But this process is preventable and possibly partially reversible. Maintaining blood sugar in a good controlled situation remains the cornerstone strategy. But we now understand that reducing age exposures through dietary choices, exercise, and even some targeted medications that are on the forefront can provide some additional protection. Let's talk about some of those interventions in our next episode. The research showing that lower age diets reduce circulating age levels within weeks offers, I think, some genuine hope for change. For anyone concerned about kidney health, whether you have diabetes, prediabetes, or simply want to protect your long-term health, the message is clear. Managing blood sugar matters immensely, but so do the often overlooked factors of how you cook your food, whether you exercise, or whether you are creating conditions that minimize glycation. As we close, remember that kidney damage from glycation develops silently over years or decades, but the time to act is now before symptoms appear. Talk to your healthcare provider about screening for early kidney disease if you have diabetes or other risk factors. Continue to monitor your HbA1c levels and push for optimal control. Consider modifying your diet to reduce age exposure. Stay physically active. These steps, supported by robust scientific evidence, can make the difference between healthy kidneys and chronic kidney disease. Thank you for joining me on this exploration of glycation and renal complications. Understanding the science empowers us to make better choices for our health. Thanks again for joining me, and let's connect again in the next episode.